Hey, it's Rob Lightfoot, proud two-time alum of Rowan University.
And I'm Jessica Kennedy, also a two-time Rowan alum. And you're listening to
Beyond the Brown and Gold.
Rowan Radio 89.7 WGLS FM presents Beyond the Brown and Gold, a show that highlights the lives and memories of Glassboro State and Rowan University alumni. Now, here are your hosts, Rob Lightfoot and Jessica Kennedy.
Jess, it's MBA time. We're going to our friends at the Roar College of Business. We're going to connect with Teray Johnson, class of 17, who, Teray's a big deal. Not only does she get one degree, a second degree, a third. She's third degree. We found out she's writing novels, right? So she's currently the director of data automation and transformation at Lifepoint Health, which is a health system with over 80 hospitals and rehab behavioral health facilities in 30 states. So she's a big deal there. But she got her MBA here from Rowan after she got an undergrad at Towson, and she got a PhD.
And she's teaching.
And
like Rob said, writing. So you're going to hear all about Teray's journey through the healthcare system, what got her interested, what she's doing now with data to support the people that support us when we are in our greatest need. Enjoy Teray's story here on Beyond the Brown and Gold. So in studio today, we have an MBA alum, and we do interview a lot of undergrad students. So it's kind of an interesting opportunity to interview Teray here today. Teray, before you got to Rowan, where did you go to undergrad? Where did you grow up?
I grew up in Swedesboro, which is about 20 minutes away from here. Small town about 30 minutes outside of Philly, right near the Commodore Barry Bridge. And before that, I actually grew up in Sicklerville until I was 8, and then we moved down to Swedesboro. So grew up a little bit in the rural area, suburban area, played outside a lot as a kid, had a lot of fun there. And I went to Towson University for undergrad down near Baltimore, Maryland.
Yep.
In Towson, Maryland. It's about half an hour away from Baltimore. So I majored in healthcare management there with a minor in business administration. Had a bit of that business background coming into Rowan as well. And since then, I worked in healthcare all my life and really loved it down at Towson. Loved meeting the people there, had wonderful professors, had a great internship where I met a preceptor who I still keep in contact with today. So that was a magical time for me, something that I wouldn't trade for anything.
And what made you go into the healthcare space? What was the motivation there?
My dad's a pastor.
Okay.
And we would often go to nursing homes, hospitals to see some of our sick church members.
Sure.
And I would often see the ins and outs of the healthcare system, the other side of it, as a patient and as a visitor. And I would see how the nurses, the doctors would treat the different patients and treat our church members who are like our own family to me. So I would see when some of them would have good days, not so good days, and that made me really interested in healthcare and the ins and outs of it, why some physicians and nurses would treat the church members well and why some wouldn't. And that made me really interested in healthcare. At first, I wanted to be a nurse, but the sight of blood does not agree with me. So I had to go into the administrative route or the management route. So that's where I am now. And I feel like now I can have even a better, broader impact than if I went in as a nurse.
Yeah, and when you say, when you say those folks who had a good day, bad day, you're not even talking about the patients. You're talking about the professionals, the healthcare professionals themselves.
Exactly. I would focus a lot on them because that's why I wanted to be when I grew up, a nurse.
By the way, like if you wanted to be in that space, the healthcare space, it's such a challenging space. So thank God there's people that want to do that piece.
Mm-hmm, absolutely.
Yeah, right? Because I can do blood. I don't mind looking at blood being drawn. I don't want to be the one doing it.
Oh, I can't even look. If they do blood in my arm, I don't even.
Really?
No. And I've had my fair share amount of blood taken through my life, and I don't look.
Same here.
Yeah, I can't. Mm-hmm. I mean,
It's
thank you.
a challenge. So I'm glad that other people want to get into that space. And I'm glad you kind of found your way sort of out of that. Well, I guess a different version of it, but into that same space.
Right.
Talk to us about, because we still have to get to obviously your MBA trajectory here, but talk to us about the medical professionals that you're seeing at the time that really kind of wanted to motivate you into the space that you decided to pursue. Like, how were you seeing burnout? Is that what the side of it was that you wanted to fix?
I think I saw burnout, but I didn't know what it was called at the time. Actually, my PhD research is in burnout as well. So I've always been interested in burnout. And even before I went to undergrad and seeing the nurses, the doctors, the different staff in the hospital and how they would act, I think I could recognize the signs of burnout, couldn't put a name to it, but that was something that I wanted to help alleviate so that they could take better care of the patients. I wanted to help equip them to do that. And that's a big reason why I got into healthcare in the first place.
Sure. So then you have Towson University, and then tell us, how does Rowan University come on the map? Just because it was around the corner from growing up, or like what was the next step for you?
I always wanted to do an MBA program or a graduate school program. I had quite a few mentors throughout my internship who encouraged me to go the MBA route. I wanted to get an MHA at first, a Master's in Health Administration. And funny kind of tragic story, I guess, about that. I had first wanted to do my MHA program right out of undergrad. So I applied to 4 or 5 schools down in the Maryland area, the Virginia area, and I was rejected from all of them. And I had to regroup. I started working down in Maryland. I was laid off from that job, unfortunately. I was a manager in training of patient transportation in Baltimore at one of the hospitals there, where they take patients to different areas in the hospital. And after I was laid off from there, I moved back to New Jersey and was trying to regroup. I was trying to find what my next steps would be. I was applying for several positions and just couldn't find my fit. I was having a tough time there. So I decided I had some experience under my belt. Why not go back for my MBA? And I was impressed with Rowan's program, looking at the website and all the courses that they offered as well. And the professors too, how they had that real world experience that I was looking for in professors. Not just in academia all their lives, but how could we apply this knowledge to our businesses and our companies and whatnot. That's what I was looking for. And I was also looking for a more general education rather than just specializing in healthcare. Healthcare is a different beast all by itself, as I'm sure you know. But having that business background, understanding ledger sheets and accounting sheets and the finances of healthcare, as well as understanding just general management principles in general, that was something that I was looking for. And another thing that attracted me to Rowan's program was the Management Information System specialization in the MBA program. I was interested in information systems, data analysis, and that program got me started in understanding how to connect different databases. As I was looking at these different job postings, I saw that a lot more jobs were asking for these different database skills. And that was something that Rowan had that other schools did not have. And that's what ultimately led me to attending Rowan.
Yeah.
And the MBA path, see, I'm interested in kind of what you were saying because I initially didn't really put the pieces together of healthcare and MBA. But like you said, it's a good opportunity to understand all facets of it and to get kind of a more broad education. So what was your experience like when you were here? Were there any professors that really stood out to you, any mentors?
I loved my time here at Rowan. When I was walking into the campus this morning, I was just hit with this wave of nostalgia. Brought back some wonderful memories of walking around the campus after work and attending classes in the evenings and how I look forward to those classes. A couple of professors stood out to me. One was Robert D'Antino. He leads the capstone course of the MBA program, and he had that real world experience. He also went to an MBA program down in one of the southern schools, and he would often talk fondly about his time there as well as his real world experience. And I just received nuggets of wisdom from him about his experience in business school and industry as well. And he was a cheerleader for all of the students in that course, especially when we wrote our different papers that we wrote about the different businesses throughout the area, throughout the country. And he wrote helpful comments that made me a stronger leader, a stronger writer. And that's an experience that I'll never forget. And He is a wonderful professor here at Rowan. Another professor who helped encourage me was Dr. Michael Milovich, who taught my systems analysis and design course as part of my management information systems specialization. He was also a cheerleader for all of his students. You could tell that he really cared about each of his students. He had office hours right before class so that busy professionals could come in before class started and talk about their courses, talk about even industry as well. He also worked in industry before he became a professor here at Rowan, so he understood where each of us was coming from. And he also encouraged me to go on to become a part-time professor. I'm now a part-time professor at one of my alma maters, Harrisburg University in Pennsylvania, where I earned my PhD in data sciences last year.
This is great.
Congratulations.
She's collecting degrees over
I
here.
know.
Yeah.
Well, I can't imagine what your degree wall must look like.
Oh,
All
yeah,
the
it's a little
frames.
bit busy to say the least.
Yeah. Now, let's geek out a little bit because I'm in the MBA program myself now. Obviously, I'm doing a concentration of finance, so it's a little different than sort of your route. Obviously, there's some core classes that we have to take. You mentioned the info systems class. I had Dr. Shen for my class. The information systems class, it wasn't something I was going in that I thought I'd really like, but I kind of liked it. I don't know. You said it was like an attraction for you. There's something about now having a better sense of like, it was, and the sad part was they truncated it down to like, so it was they do a double time. So you basically did a truncated version of the class. I wish it were extended. I still have the digital version of the book for like another 120 days. I want to read the whole thing. But it does. It talks about how...
Before bedtime?
Before
Maybe a
bedtime. It
bedtime
talks about like how do databases connect, how to do enterprise solutions, how to why does that work for us? Why does that work for our simple heads? Well, not my simple head. You have a PhD. I don't know.
I think it works for everybody, but I mean, I think it works because, like I said, in industry, they're really looking for those database professionals now. And data's almost everything in industry and whatever company you go into, healthcare, banks, whatever it is, that's something that is so important right now. And understanding how to connect those different databases, which is something that I learned here at Rowan and I apply to my job still today. It's something that I'll always take with me going into my different positions, my different jobs. It's been a part of every job that I had. So I think it works just because of the importance of data and understanding not only how to bring those different databases together, but what you're looking at, how to analyze that data, and then communicate that to a non-technical audience.
Now, when you were here getting your MBA at Rowan, were you also working at the time, or were you? Yes. Okay. So she looks tired. She gave an exhausted.
She's got 19
yes.
degrees.
Yeah.
She's got 19 degrees. Of course, she'd be tired.
So, what were you doing professionally while you were getting your MBA here?
I had just started here at the work-study program at Rowan.
Okay.
So I was looking for jobs when I was applying for MBA programs, of course. Came across Rowan's work-study program at a place called the Camden Coalition in Camden, New Jersey, where it's an accountable care organization. And basically what that means is they bring together different healthcare providers to help provide the best care for the patients in that area. They serve Medicaid patients, so patients who might not be receiving the best care because of their insurance, which doesn't pay that much to the different providers. So I started working there as one of their administrative assistants, essentially, working with the different providers in the hospital to present some of their data, some of their scorecards, and establish stronger relationships with those providers, as well as reaching out to the patients to connect them with these different providers to get their appointments, connect them with transportation, and help them make sure that they were getting the best care as possible. So that's what I was doing while I was working at Rowan. And then thankfully, after that work-study program was up, I was offered a full-time job there. So I started working there full-time, close to the end of my MBA program here.
I think there's like a good career lesson too coming out of your story for folks, especially for students that want to be involved, in the trajectory of a specific industry, and the fact that, hey, I always ask my nephew, like, well, you want to do this for a living. What are you doing now while you're in school? He's currently a junior. Like, what are you doing now? What clubs, organizations are outside
to help put you in that,
to help kind of put you in the right seat to kind of either network or also build up your sort of portfolio to get to that next step that you want to get to? And it sounds like that's where that healthcare space and that care space kind of worked for you.
Yeah, absolutely. I would say that was 100% the truth there. The healthcare space and just working in the healthcare space while I was in school helped me apply the lessons that I was learning as well. And you were talking about career lessons, and one thing that I learned was just to be humble and be patient. This position didn't require a bachelor's degree that I was in this work study program, but I applied anyway. I received the position, and I worked hard to get that full-time position close at the end of that program. So never think that anything is beneath you. Just continue to work hard, work your way up, and excel at whatever position you're in, and you'll make it wherever you're trying to go.
So you get your MBA. We'll say one more thing about the MBA program, just because I'm a little.
Like you are geeking
I
on the
won't geek
MBA
in the
program. I love it.
I don't know if you had interaction, but Jay Salvatore, shout out to him, who works over there. I call him. It's not his real title. I call him a student navigator. I feel like that's cool.
Yeah, that would be a cool title.
They
It's
should
not a real
change it.
title.
It's not a real title.
Well, what's his real title?
I don't know.
Okay.
But I just know he's very helpful. Like, so when I got into the MBA program, and I don't know if you can speak to this, Teray, but when I got into the MBA, or when I was looking at and poking around the MBA program, Jay Salvatore went like this. Here's a piece of paper. Here's the classes you're going to take during this semester, that semester, this next semester. He streamlined the whole...
Is he an advisor? Is he an advisor?
Okay, let's call him an advisor. Yeah, that works.
That sounds like that's what an advisor does.
Doesn't navigator
Exactly.
sound better than an advisor?
I mean,
Well,
it's
that
all
sounds
cool.
a little bit cooler.
Yeah.
It sounds like he's going to fly airplanes on the side.
I know, but a navigator. Just imagine if you're telling your friends you're a navigator. Anyway, I don't know, but he was a very, like, for me, for somebody who, is doing the 48-plus hour week, I needed somebody to say, hey, here, this is it. Here's how you get through the program and effectively, because this is when these certain courses will be offered, and they won't be offered certain other semesters. Did you have that same experience? Because you were a busy person at the time.
Yeah. I had that experience as well, where the people at Rowan really came alongside me and helped me chart my course. And even on the website, it's very clear about what sort of milestones you have to hit to graduate from the program. And that was really helpful with charting my course going forward. And even before I came to Rowan with the prerequisites, I know you said, Rob, that before we got on this podcast that you're taking that calculus class.
Yes.
Yeah.
Yeah,
so,
what a time.
Yeah, it's a fun time for sure. I also had to do that before I got into Rowan's MBA program. So they were really helpful with how to take that course. I was able to take that right at Rowan College of Gloucester County and then transfer that over here. So that was really helpful advice from the advisor, that I could just take that right at the community college right here and then transfer that over instead of taking it here on campus.
She had to take it before she even got here. You must have got through some red tape or something.
I know. I happen to know a guy who's a navigator. I'm just saying. He was a navigator type of thing,
So talk to us about your career path post getting your MBA here at Rowan.
Yeah, my career path really took off from there, I would say. I remained at the Camden Coalition for about a year after graduation, and after that I had started working for Crozier Health in Pennsylvania. You all might be familiar with that. Right across the bridge, their flagship hospital is in Chester, Pennsylvania, once again serving mainly Medicaid, Medicare patients, an older population, a younger population who might not have as many resources to get to hospitals and get health care. So I worked there first in the nursing administration department, where my position was kind of half administrative assistant, half data analyst as well. So here I was really starting to get into the data part of healthcare, and it was a part that I loved doing. And I also loved serving the nurses and learning more about nurse leadership as well. And the nurses handled everything with grace. Handled me with grace, I would say, on my not so good days there. And they were so generous, so kind to their patients, to their peers, to the fellow leaders in the hospital, and to me as well. I'll never forget Administrative Professionals Day just passed this past year. I think it was last week or so. And on that day, I just had some wonderful memories of being at Crozier Health as their nursing data coordinator was my title there. And the nurses held a little party for me that day where they bought me lunch, celebrated me and all that I did for them, my work for them. They were really happy with the work that I did for them, taking some of that administrative burden off of them so they could focus more on their nurses and caring for them and making sure that they could give the best care as possible to their patients. So they really made me feel special that day and throughout my tenure there.
So let's talk about nursing leadership. I love leadership stuff. So talk to us about what are some of the positives or, positive strategies, tactics that you saw from some of the nurses that were like the strong leaders in the group.
They were hands-on. When the hospital became busy, they had no problem jumping in there and giving care to the patient, even though that wasn't necessarily part of their job description. That was something that stuck out to me as a leader myself, just being willing to jump in and help in whatever way possible, not thinking that anything is above or below your job position or your job title. That's something that stuck out to me as a leader. And when I first got there, the chief nursing officer would sit with me almost every day and help train me on what to do. And that's something that stuck out to me too. She was never too busy for me. She always found the time to spend with me, answer all my 1,000 questions that I had, and helped walk me through this complex healthcare landscape. That was something that I really appreciated as well, and I still keep in contact with them today.
And how can nurses themselves, if they're listening to this program, how can they help themselves to just maintain, but also avoid burnout, to continue a high level of care? Because, patients are challenging, right? Mm-hmm. Patients at the hospital,
you're seeing people at like some of their most frustrated and not feeling well. Mm-hmm. So it's got to be challenging. Just
absolutely,
you're walking into a challenging situation. People don't go to the hospital because they're in a good mood and feeling great.
Right? Yeah.
Right. Yeah, that's the truth. I think that what nurses can do, like you were saying, patients come. Nobody wants to be in the hospital.
No.
Even visitors, they don't want to be in that hospital either. And I think that what I saw that was really helpful for nurses was talking about it. That was something else that the Nursing Leadership at Crozier did. They always had an open door policy, so the staff nurses who were giving the patients care could walk into that office, shut the door, and talk about whatever issues that they had and seek counsel for those issues. Not holding everything inside, but going to those trusted mentors, whether that be the nursing leaders in the department who had those formal titles, or going to the more seasoned nurses in the department. That could be really helpful with helping to alleviate some of that burnout. And being honest with your nursing leaders as well, saying if they need a wellness day to spend time with their family, take that wellness day. There's nothing wrong with that. We call our nurses heroes, and they are heroes, but we can't do everything either. They can't do everything. They're not inhuman. It's important to take that time for yourself, take that time with your family, and get connected to what made you go into healthcare in the first place. I think that helps with that burnout as well.
So you've been working with the healthcare industry through a crazy time. So you went through COVID working in the health. What was that like? What kinds of studies were you doing? What kinds of things were you seeing?
Yeah. I was working at Crozier at the time COVID hit. And it was something. I had just transferred to the quality department where they handle patient harm, patient safety, making sure that patients stay safe in the hospital. And I was talking to some of the nurse leaders who I was working with previously, and you could hear it in their voice how tired they were and how busy of a time it was. So even though I wasn't sitting in the unit anymore, I could tell that the nurses were overwhelmed with it. If you were following the news at that time, you might have seen that Crozier was one of the first hospitals in the area to get the first COVID patient. I think that was at the end of January. So they had the media in the hospital as well. They were trying to address the patient who had COVID. And we didn't know a lot about COVID at the time. So it was a very scary, very stressful time for the nurses During one of the leadership meetings, the nurses were discussing how to address the patient, how to isolate the patient so that nobody else caught the disease as well. And you could just see the stress on their face. It was a Friday afternoon, but you could tell that it was going to be a long night for them. So just talking to some of the nursing leaders there, seeing the stress in their voices, and even in the quality department, seeing some of the nurses who worked in the quality department as well and how stressful that time was for them. They were getting calls, the infection prevention managers whose job was to help handle and understand these different diseases. They were stressed out as well, and I was seeing them work these long hours and not really know what to do either. So it was a stressful time in the healthcare industry in that hospital as well.
So now you're also teaching, right?
Yes.
So tell us about that experience. Very different from your other work.
Yeah, I just started teaching this past month in March. It's been quite an experience being on the other side after being in academia so long of my life, being on the other side of that. But I'm really enjoying the experience. We just passed a halfway point of the semester. I'm teaching statistics for their Harrisburg University's Master of Analytics program. When I first started the MS program, I didn't know that statistics was kind of the foundation for data sciences. And it's been something because I took that course when I was at that program, but just being on the other side of it is almost surreal a little bit, but I've really enjoyed watching the students grow throughout my time there and watching them begin to understand the statistics behind data sciences and seeing them grow in their assignments from week to week, grow in the questions that they ask from week to week, how those questions show their depth of understanding of the concepts now. And it's been wonderful to give back in a way, give back to the next generation of data analysts and data sciences. It's been a wonderful experience.
So did your family see you in all this data? You're doing a lot of this data, Did the family see like your trajectory going this way?
I don't think they did. I don't think they did.
Did you see that? Did you see it happening?
I did not see that at first.
Well, okay, what was your first go? What did you want to do first?
Well, what I wanted to do first, and actually what I still want to do, well, it's kind of twofold. At first, I wanted to be a hospital CEO, but then as my career progressed, I had some encouragement from some of my mentors at Towson University as well, who encouraged me not just to be a hospital CEO, but to look at being a health system CEO, to have a broader impact on the patients, the staff who work there. And that's now what I want to do. And part of the reason I got into data was because, and part of the reason I also started at Rowan's MBA program is because my first positions right out of college were more on the administrative assistant side, and I was starting to get pigeonholed into that position, and that's not where I wanted to stay. So I gained some valuable operations experience, but I wanted to use my brain more, so to speak. I wanted to analyze some of that data. And that was something that I was looking at in these different positions that I was applying for, that you could analyze data, you could use a lot of your brain power, so to speak, to help move these companies, these healthcare companies, to providing better care for their patients. Even those people in these positions were not providing care directly to patients, they could still have an impact on those patients. And also, I love that data kind of touches every area of the hospital, as that's something that I need experience for to be a health system CEO. I was in quality, I was in nursing administration, I was with an accountable care organization where I work with primary care offices as well. And those are all parts of the health system. And that's something that has been valuable to me as a data scientist.
Are you responsible for collecting the data, analyzing it, and then making recommendations? Or do you focus on one of the key areas? Or are you kind of, if it's data, it's in your wheelhouse?
Pretty much the latter. If
Okay.
it's data, it's pretty much in my wheelhouse. I work with collecting the data, analyzing the data for the different departments in my health system as well. So my official title is the Director of Data Automation and Transformation. I currently work for Lifepoint Health, who's based in Brentwood, Tennessee, which is near Nashville. And they have about 60 hospitals throughout the southern U.S. They own Kindred Healthcare, which is a little bit more well-known. They have rehab hospitals. And I work with analyzing the data for them, as well as automating some of their processes for their administrative employees. So once again, going back to reducing that burnout for non-patient facing employees. So that's a little bit about what I do on a daily basis.
I feel like we have to ask this question because it's data. Tell us how excited you are about data as it relates to AI and all that encompasses.
Yeah.
Does it scare you? Does it excite you?
It excites me. I think that it depends on how you use it, of course. There are a lot of misconceptions about AI and what exactly it is.
But you obviously have probably more of appreciation for the application of what it could help you.
Absolutely. I think that AI can help with that administrative burnout that we were talking about earlier. I think that things like ChatGPT could be used to automate a lot of the processes that people do, whether that be writing emails or any other task that they do on a repetitive basis that can help take away that time for that and give them more time to work at the top of their license.
I love ChatGPT.
Yeah.
I do because sometimes it's like I could spend a very long time writing something and hating it. And then I feel like I can use ChatGPT to say, this is really what I want to say and how I want to say it. And please help me so I don't spend the next hour and a half just pulling my hair out, making it perfect. And then usually it spits something back and I'm like, let me fix this. But it's nice to be able to use technology to help take away some of the pain points of your job and make things easier. So like you said, you could spend more time doing things that you need to be doing.
Absolutely.
So what are you doing when you're not doing all this healthcare stuff and this data?
Yeah, I write a lot.
Okay.
I'm writing a fantasy novel. I finished it about a year ago, and now I'm editing it.
Wow.
Yeah.
We just had an author on
Yeah.
writing fiction.
Yes.
We should connect the
wow.
two of you. Yeah.
Yeah, that would be wonderful.
Yeah.
I finished it about a year ago. I'm hoping to get it published with one of the big publishing companies. I don't want to go the self-publishing route unless I have to for some reason, but I love to get it published with one of the big publishing companies like Simon & Schuster, one of those companies. And it's about different people who gain powers through a natural disaster almost. And it's about how one person who gets these powers gets the power to give different powers to other people. And he curses somebody who accidentally wanders into this so-called God's territory, even though he's just a little boy, didn't know what he was doing. So the boy grows up, he's ostracized all his life, and now he's trying to get revenge on humanity because of what happened to him. So the story starts when a hero comes in and tries to stop this person from wreaking havoc on humanity. And the story is strong in themes of friendship, strong in themes of redemption. And I try to focus a lot on character development as well and softening this once boy's heart so that he becomes open to friendship, open to relationships, and open to the goodness of mankind as well. So that's a little bit about what it's
great.
about.
You send it to us. We'll read it.
Yeah, of course. I'll hold you to that.
I'm watching TV and she's writing novels. You know what I mean?
Rob, we're boring.
I know.
We're just not as talented as everybody else, okay?
I want to relax when I'm done all this work. I don't want to be writing more work.
Oh, yeah. I
But that must
understand
be relaxing for you.
It
I'm sure.
is. It really is. It's a
She
great
spends
stress
her whole day
reliever.
in data.
Yeah.
That's like a creative outlet. That, if you think about it, that's a
Absolutely.
way different thing than what
Yeah.
she's doing on the regular. So
Mm-hmm.
now you're working for a company based in Nashville. Have you been out to Nashville? Do you get to go visit?
I just went there last week,
And
actually.
did you love it? I've heard great things.
Yeah,
I've
everybody
never
loves
been.
Nashville, right?
Yeah, it was nice there. I really enjoyed it. I would love to have been there a little bit longer so I could really enjoy it a bit more properly. I went there about 12 years ago with my family for a church conference there and really enjoyed it there and visited some of the sights and sounds that we went to before, like the mall there, and the food there is amazing. So if you are a foodie, you're in the right place.
Not this guy.
No, not me. I'm not that adventurous.
I love food.
Yeah.
we should do a Beyond the Brown and Gold live from Nashville. We got to have an alum out there calling all Nashville alums.
We'll try to hit all 50 states to see who we can get and go visit, right?
That'd be so fun.
That would be so fun.
We're going to have to talk to university leadership about a budget for that.
I'm sure
Absolutely.
they'll prove that. Right?
Of course. Why not?
Well, Teray, it's been so fabulous to have you on today and to learn about what you're doing and very important work that you're doing to make sure that the people that are taking care of us are being taken care of. So we applaud you for everything that you're doing to help the people that we need the most in the world.
Yeah, it's been wonderful to connect with the both of you, to be on this podcast. And I'm just hopeful that my story will help people in their own career path as well and give them some clarity. So it's been wonderful to be able to give back to the Rowan community in this way.
Okay, Rob, so you and Teray geeked out big time over the MBA program.
Yep.
You are love it. How much longer do you have left?
That's a great question.
Okay.
I think I have about 1.5 years or so, and then that should put a nice little bow on it.
Okay, and then what is what are you hoping to do once you have this MBA?
Yeah, so it's what they do with the MBA program. That's what they do, obviously, with most programs here. They're giving you the broad brush, right? So everybody will take the same core foundation classes so that you can do the data systems and such. My concentration's in finance because that's kind of my passion space, but you can move it to anywhere. So where Teray's was in information systems and that MIS space, mine's me in finance.
Okay.
And I just want to do finance stuff all the time.
All the time.
All the time.
All the time.
Yeah.
Can you help me with my finances?
Yeah. That's all I really do anymore.
Yeah.
But no, it's great. It's a cool space to be in, and I'm loving the program so far. The MBA is great. It's just another way to elevate yourself a little bit, stand out from the pack.
Well, if you're interested in the MBA program, we can connect you. So
Yeah.
just reach out to us. We have really amazing, awesome friends over in the College of Business with this program. A lot of incredible alums coming out. We've actually received so many requests to interview our MBA alums, and we know that we have so many wonderful alums doing things out there, but we got to spread the love through all of our colleges.
Yeah. And for folks that are considering it,
yeah.
Are there scary parts? Yes, but the scary parts are every part of life. But it's mostly online, so you can make it easy. Is that a good sales plug for these guys?
I think so. I think that's great.
Okay.
Well, Teray is definitely a shining example of what the MBA program here at Rowan can do for you. And we were so glad to have her in studio today. And we'll be getting another MBA alum on here sooner rather than later.
You've been listening to Beyond the Brown and Gold on Rowan Radio 89.7 WGLS FM. You can find more episodes on your favorite podcasting platforms by searching for Beyond the Brown and Gold or Rowan Radio On Demand.